Hello and welcome to Senior Healthcare, where we focus on the vital signs that your body uses to communicate its internal state. I am Dr. Queen, and today we are diving deep into a topic that is often overlooked, but serves as one of the most accurate diagnostic tools available to you every single day. Your urine is far more than just a waste product of the metabolic process. It is actually a window into the health of your kidneys, your liver, your heart, and your endocrine system. Every time you visit the bathroom, your body is providing you with a biological report card that can alert you to life-threatening conditions long before you feel any physical pain. Many people make the mistake of flushing away this information without a second thought, but understanding the nuance of color, scent, and consistency can save your life. We are going to explore 12 urgent signs that you must never ignore, and we will explain the medical dangers behind each one. The first and perhaps most alarming sign is the presence of a reddish or pinkish tint in the urine, which is medically referred to as hematuria. While it is true that certain foods like beets or rhubarb can temporarily discolor your urine, the presence of actual red blood cells is a major clinical red flag. Even a microscopic amount of blood can indicate a variety of serious issues ranging from simple urinary tract infections to more complex problems like kidney stones or even bladder and kidney malignancies. In the world of senior health, we are particularly concerned about intermittent bleeding because tumors in the urinary tract often bleed and then stop leading a patient to believe that the problem has resolved itself when in fact the underlying cause is still progressing. If you see even a hint of red, you must seek a professional evaluation immediately to rule out cancer or severe renal trauma. The second sign is cloudy or murky urine, which should never be considered normal for a healthy adult. Under ideal conditions, urine should be clear and straw-colored, representing a proper balance of hydration and waste filtration. When urine appears milky or contains visible sediment, it is usually an indication of an accumulation of white blood cells, bacteria, or crystals. This is often the primary warning sign of an ascending urinary tract infection that is moving from the bladder toward the kidneys. If left untreated, this bacterial load can cause permanent scarring of the renal tissue leading to chronic kidney disease. In some cases, cloudiness can also be a sign of high levels of minerals like calcium or phosphorus, which are the building blocks of painful kidney stones. Third on our list is foamy or bubbly urine, which is a classic indicator of protein leakage. While a few bubbles are normal due to the force of the stream, if the foam is thick and resembles the head on a glass of beer, it signifies that your kidneys are failing to keep essential proteins in your bloodstream. This protein is called albumin, and its presence in the urine is one of the earliest signs of chronic kidney disease, often triggered by long-term high blood pressure or undiagnosed diabetes. When the microscopic filters in your kidneys, known as nephrons, become damaged, they become leaky, allowing life-sustaining proteins to escape into the waste stream. Ignoring foamy urine can lead to total kidney failure, requiring dialysis or a transplant, so this is a sign that demands an immediate urine protein test. The fourth sign involves a transition to a very dark orange or brownish color, which can be quite startling to witness. While this can sometimes be a symptom of extreme dehydration, it is more frequently associated with liver dysfunction. When the liver is inflamed or damaged by conditions like hepatitis or cirrhosis, it loses its ability to process bilirubin, which is a byproduct of red blood cell breakdown. Instead of being excreted through the digestive tract, this bilirubin enters the bloodstream and is filtered by the kidneys, giving the urine a dark, tea-colored or cola-like appearance. This is a sign that your liver is under significant stress and may be failing to detoxify your blood effectively. At Dr. Queen Senior Healthcare, we emphasize that monitoring these early color shifts can allow for interventions that prevent permanent organ damage. Your body is constantly providing you with the data you need to stay healthy, and it is our mission to ensure you know how to read it. Continuing our exploration of these critical warning signs, we move to the fifth indicator, which is a distinctly sweet or fruity smell coming from your urine. While most people do not make a habit of noticing the scent of their waste, a sudden change to a sugary or sweet aroma is a massive clinical indicator of elevated blood sugar levels or diabetes mellitus. When your body has an excess of glucose that the pancreas cannot manage through insulin, the kidneys attempt to flush that sugar out of the system. This process is known as glycosuria, and because sugar is an osmotic agent, it pulls water along with it, which is why diabetics often feel a constant sense of thirst. If you notice this sweet scent, it means your blood sugar has likely crossed a dangerous threshold and your kidneys are working overtime to prevent a toxic buildup. At Dr. Queen Senior Healthcare, we warn that ignoring this could lead to diabetic ketoacidosis, which is a life-threatening emergency where the blood becomes too acidic. The sixth sign to monitor is an intense ammonia-like smell or a foul chemical odor. While concentrated urine due to simple dehydration can smell strong, a sharp ammonia scent often suggests that your body is struggling to process nitrogenous waste products. In a healthy system, the liver converts ammonia into urea, which the kidneys then excrete. However, if the liver is sluggish or if there is a specific type of bacterial infection in the bladder, those bacteria can break the urea back down into ammonia right inside your body. This is a common occurrence in chronic urinary tract infections that have become deep-seated. It can also be a sign of advanced liver disease, where the organ is no longer capable of performing its primary detoxification roles. Moving to the seventh sign, we must discuss the frequency and urgency of urination, especially when it interrupts your sleep multiple times a night, which is medically termed nocturia. If you find yourself waking up 3 or 4 times to use the bathroom, it is rarely just a sign of getting older. In men, this is often the primary symptom of benign prostatic hyperplasia or an enlarged prostate, which puts pressure on the urethra and prevents the bladder from emptying completely. Because the bladder never fully clears it, refills quickly, leading to a constant cycle of urgency. In both men and women, frequent nighttime urination can also be a hidden sign of congestive heart failure. During the day when you are upright, your struggling heart may allow fluid to pool in your legs and ankles, but once you lie flat at night, that fluid re-enters your bloodstream, and your kidneys have to process it all at once, resulting in frequent trips to the bathroom. The eighth sign is a persistent burning sensation or sharp pain during the act of urination known as dysuria. This is a clear signal of inflammation somewhere in the lower urinary tract. While most people immediately think of a bladder infection, the danger lies in how quickly that infection can travel. If the burning is accompanied by a dull ache in your lower back or sides, it means the bacteria have likely ascended the ureters and are now attacking the kidneys themselves. A kidney infection or pyelonephritis can cause permanent organ scarring, and if the bacteria enter the bloodstream, it can lead to urosepsis, which is a systemic and often fatal inflammatory response. At Dr. Queen Senior Healthcare, we have seen that seniors are particularly vulnerable to these infections because their immune systems may not mount a fever response right away, making the burning sensation the only early warning available. The ninth sign is the presence of visible sediment, or small white particles floating in the urine. This is not merely a sign of concentrated waste, but is often composed of sloughed-off tissue from the bladder lining or colonies of fungi and bacteria. In some cases, these particles are actually tiny crystals that have not yet clumped together to form a full-sized kidney stone. If you see what looks like sand or grit in the toilet, it means your urine is supersaturated with minerals like calcium or uric acid. This is a major warning that you are at high risk for developing a stone that could eventually block the flow of urine entirely, which causes excruciating pain and potential kidney damage due to back pressure. We must remain vigilant because these 9 signs are the body's way of begging for intervention before a manageable condition turns into a surgical or intensive care requirement. Every shift in the chemistry of your urine is a data point that we can use to adjust your nutrition, your medication, and your overall lifestyle to ensure that your senior years are spent in health rather than in the hospital. As we prepare to look at the final and most severe signs in the next part of this explanation, remember that your observations at home are the first line of defense in the medical process. Entering the final and perhaps most critical phase of our discussion, we must address the 10th urgent sign, which is the appearance of unusual colors like green or blue in your urine. While this can sometimes be attributed to food dyes in candy or specific medications such as antidepressants or anti-inflammatories, it can also be a sign of a very specific and aggressive bacterial infection known as Pseudomonas. This type of bacteria can cause a green tint to the urine and is often resistant to standard antibiotics, making it a significant concern in clinical settings. If you see these colors and haven't recently changed your diet or medication, it is a signal that your immune system is facing a unique challenge that requires specialized testing. The 11th sign we must confront is urinary incontinence, or the sudden and involuntary loss of bladder control. Many people, especially in their senior years, mistakenly believe that leaking urine is a normal and unavoidable part of aging. But at Dr. Queen's Senior Healthcare, we treat this as a major neurological or structural symptom. It could indicate that the nerves communicating between your brain and your bladder are being compressed or damaged, which can happen in cases of spinal stenosis, severe disc herniation, or even early-stage neurological disorders like Parkinson's or multiple sclerosis. In men, it may also signal that the bladder is so full due to a prostate blockage that it is simply overflowing. This loss of control is a major quality of life issue, but more importantly, it is a warning that the coordination of your internal systems is beginning to falter. Finally, the 12th sign, and perhaps the most dangerous of all, is a sudden and drastic change in the volume of urine you produce, specifically a significant decrease known as oliguria, or a total stop known as anuria. If you are drinking your usual amount of water but find that you are barely producing any urine, it is an absolute medical emergency. This suggests that your kidneys have either suffered a sudden injury or there is a physical blockage such as a massive stone or a tumor that is preventing waste from leaving your body. When the kidneys stop producing urine toxins, like potassium and urea, build up in your blood within hours, which can lead to heart arrhythmias or even a coma. Now that we have covered all 12 signs, it is vital to discuss what you should do next to protect your longevity. At Dr. Queen Senior Healthcare, we recommend that anyone noticing these changes should request a comprehensive metabolic panel and a professional urinalysis. We look specifically at your glomerular filtration rate, or GFR, which measures how many milliliters of blood your kidneys are cleaning every minute. We also check your creatinine and blood urea nitrogen levels to ensure your filtration system is not backing up. Beyond testing, you must look at your daily habits and the medications you take. Many people unknowingly damage their kidneys by the chronic use of non-steroidal anti-inflammatory drugs like ibuprofen or naproxen for minor aches and pains. These drugs can restrict blood flow to the kidneys and cause long-term scarring if used excessively. Furthermore, managing your blood pressure is the single most effective way to prevent the protein leakage we discussed earlier, because high pressure acts like a jackhammer on the delicate filters of your kidneys. Your diet also plays a massive role, so we advise reducing processed sodium, which forces the kidneys to work harder to maintain balance, and increasing your intake of water to keep the urinary tract flushed. However, remember that even too much water can strain a failing system, which is why professional guidance is so important. Your health journey is a marathon, not a sprint, and your urine provides the mile markers that tell us if you are on the right track or if you are heading toward a cliff. Do not be embarrassed to discuss these symptoms with your healthcare provider, because being proactive today is the only way to ensure a vibrant and independent future. Thank you for listening to this comprehensive guide from Dr. Queen Senior Healthcare. We are dedicated to your wellness, and we encourage you to stay vigilant and pay attention to every signal your body sends you. Your life depends on the choices you make when you see these warning signs, so take action immediately and protect your health for the years to come. That concludes our explanation of the 12 urgent signs in your urine. Stay safe and stay informed.